Hi dear friends, welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, you will go through 25 NCLEX-RN nursing examination multiple choice questions and answers. Read the question by yourself.
431. During the admission process of a client who is admitted to the hospital for surgery to remove a tumor, the client asks the nurse if a living will, prepared 3 years ago, remains in effect. Which response should the nurse provide to the client? 1. Yes, a living will never expires. 2. You need to speak with an attorney. 3. I will call someone to answer your question. 4. It requires renewal yearly with your physician. Answer. 4. Rationale. The client should discuss the living will with the physician on a regular basis to ensure that it contains the client's current wishes and desires based on the client's current health status. Option 1 is incorrect. Although the client consults an attorney if the living will must be changed, the accurate nursing response is to tell the client that a living will should be reviewed. Option 3 is not at all helpful to the client and is, in fact, a communication block and places the client's question on hold. 432. The nurse reviews wound culture results and learns that an assigned client has methicillin-resistant Staphylococcus aureus, MRSA, in a wound bed. Which type of transmission-based precautions does the nurse institute for this client? 1. Enteric precautions. 2. Droplet precautions. 3. Contact precautions. 4. Airborne precautions. Answer. 3. Rationale. Contact precautions include standard precautions and require the use of barrier precautions such as gloves and goggles. Contact precautions are used for clients who have diarrhea, draining wounds, or methicillin-resistant infections. The goal of these precautions is to eliminate disease transmission resulting either from direct contact with the client or from indirect contact through inanimate objects or surfaces that the pathogen has contaminated, such as instruments, linens, dressing materials, or hands. Enteric precautions are initiated if the organism is transmitted via the gastrointestinal tract. Droplet and airborne precautions are used if the organism is transmitted via the respiratory tract. 433. The nurse is caring for a client immediately after a bronchoscopy. The client received intravenous sedation and a topical anesthetic for the procedure. To provide a safe environment for the client at this time, the nurse plans to 1. Place a padded tongue blade at the bedside in case of a seizure. 2. Connect the client to a bedside ECG to monitor for dysrhythmias. 3. Place a water-sealed chest drainage set at the bedside in case of a pneumothorax. 4. Check the bedside to ensure that no food or fluid is within the client's reach to prevent aspiration. Answer. 4. Rationale. After this procedure, the client remains NPO until the cough, gag, and swallow reflexes have returned, which is usually in 1 to 2 hours. Once the client can swallow and the gag reflex has returned, oral intake may begin with ice chips and small sips of water. No information in the question suggests that the client is at risk for a seizure. Even though the client is monitored for signs of any distress, seizures would not be anticipated, and therefore a padded tongue blade would not be placed at the bedside routinely. No data are given to support that the client is at increased risk for cardiac dysrhythmias. A pneumothorax is a possible complication of this procedure, and the nurse should monitor the client for signs of distress. However, a water-sealed chest drainage set would not be placed routinely at the bedside. 434. A client with a history of silicosis is admitted to the hospital with respiratory distress and impending respiratory failure. To ensure a safe environment, the nurse plans to have which of the following items readily available at the client's bedside? 1. Code cart. 2. Intubation tray. 3. thoracentesis tray. 4. Chest tube and drainage system. Answer. 2. Rationale. Respiratory failure occurs when insufficient oxygen is transported to the blood or inadequate carbon dioxide is removed from the lungs, and the client's compensatory mechanisms fail. The client with impending respiratory failure may need intubation and mechanical ventilation. The nurse ensures that an intubation tray is readily available. The other items are not needed at the client's bedside. A code cart is used for resuscitation. A thoracentesis tray contains the necessary items for performing a thoracentesis. A chest tube drainage system is used to treat a pneumothorax. 435. A nurse is preparing to administer a first dose of pentamide in isothanate, pentam 300, intravenously to a client. Before administering the dose, the nurse should place the client, 1 in a private room, 2 in a supine position, 3 in a semi-Fowler's position. 4 on respiratory precautions. Answer: 2. Rationale: pentamide in isothanate is an anti-infective medication and can cause severe and sudden hypertension, even with administration of a single dose. The client should be lying down during administration of this medication. The blood pressure is monitored frequently during administration. Options 1 and 4 are unnecessary. Option 3 is incorrect. 436. A nurse is administering a dose of intravenous hydralazine, aprisilin, to a client. To provide a safe environment, the nurse ensures that which item is in place before injecting the medication? 1 central line, 2 thermometer, 3 Foley catheter, 4 blood pressure cuff. Answer: 4. Rationale: hydralazine is an antihypertensive medication used in the management of moderate to severe hypertension. The blood pressure and pulse should be monitored frequently after administration, so a blood pressure cuff is the item to have in place. Although intravenous access is needed, a central line is unnecessary. Options 1, 2, and 3 are not necessary and are unrelated to the administration of this medication. 438. A home care nurse is visiting an older client who has been recovering from a mild brain attack, stroke, affecting the left side. The client lives alone but receives regular assistance from her daughter and son, who both live within 10 miles. To assess for risk factors related to safety, the nurse should do which of the following? Select all that apply. 1. Assess the client's visual acuity. 2. Observe the client's gait and posture. 3. Evaluate the client's muscle strength. 4. Look for any hazards in the home care environment. 5. Ask a family member to move in with the client until recovery is complete. 6. Request that the client transfer to an assisted living environment for at least 1 month. Answer: 1, 2, 3, 4. Rationale: to conduct a thorough client assessment, the nurse assesses for possible risk factors related to safety. The assessment should include assessing visual acuity, gait and posture, and muscle strength because alterations in these areas place the client at risk for falls and injury. The nurse should also assess the home environment, looking for any hazards or obstacles that would affect safety. Asking a family member to move in with the client until recovery is complete and requesting that the client transfer to an assisted living environment for at least 1 month are not assessment activities. Additionally, nothing in the question indicates that these actions are necessary, therefore these options are unrealistic and unreasonable. 439. Which of the following examples relate to medical asepsis to reduce and prevent the spread of microorganisms? Select all that apply. 1. Practicing hand hygiene. 2. Reapplying a sterile dressing. 3. Sterilizing contaminated items. 4. Applying a sterile gown and gloves. 5. Routinely cleaning the hospital environment. 6. Wearing clean gloves to prevent direct contact with blood or body fluids. Answer: 1, 5, 6. Rationale: medical asepsis, or clean technique, includes procedures to reduce and prevent the spread of microorganisms. Practicing hand hygiene, wearing clean gloves to prevent direct contact with blood or body fluids, and routinely cleaning the hospital environment are examples of medical asepsis. Surgical asepsis involves the use of sterile technique. Examples of surgical asepsis include reapplying a sterile dressing, sterilization of contaminated items, and applying a sterile gown and gloves. 440. A nurse is caring for a hospitalized client who is having a prescribed dosage of clonazepam, clonopin, adjusted. Because of the adjustment in the medication that is being made, the nurse should plan to 1. Weigh the client daily. 2. Observe for ecchymosis. 3. Institute seizure precautions. 4. Monitor blood glucose levels. Answer. 3. Rationale. Clonazepam is a benzodiazepine that is used as an anticonvulsant. During initial therapy and periods of dosage adjustment, the nurse should initiate seizure precautions for the client. Options 1, 2, and 4 are unrelated to the use of this medication. 441. The nurse is planning to obtain an arterial blood gas, ABG, from the radial artery of a client with chronic obstructive pulmonary disease, COPD. To prevent bleeding after the procedure, the nurse should plan time for which activity after the arterial blood is drawn. 1. Holding a warm compress over the puncture site for 5 minutes. 2. Encouraging the client to open and close the hand rapidly for 2 minutes. 3. Applying pressure to the puncture site by applying a 2-2 gauze for 5 minutes. 4. Having the client keep the radial pulse puncture site in a dependent position for 5 minutes. Answer. 3. Rationale. Applying pressure over the puncture site for 5 to 10 minutes reduces the risk of hematoma formation and damage to the artery. A cold compress would aid in limiting blood flow, a warm compress would increase blood flow. Keeping the extremity still and out of a dependent position will aid in the formation of a clot at the puncture site. 442. The nurse is admitting to the nursing unit a client who has an arteriovenous avenue fistula in the right arm for hemodialysis. The nurse plans to best prevent injury to the site by implementing which of the following? 1. Applying an allergy bracelet to the right arm. 2. Putting a large note about the access site on the front of the medical record. 3. Telling the client to inform all caregivers who enter the room about the presence of the access site. 4. Placing a sign at the bedside that says no blood pressure, BP, measurements or venipunctures in the right arm. Answer. 4. Rationale. There should be no venipunctures or blood pressure measurements in the extremity with a hemodialysis access device. This is commonly communicated to all caregivers by placing a sign at the client's bedside. An allergy bracelet is placed on the client with an allergy. Placing a note on the front of the medical record does not ensure that everyone caring for the client is aware of the access device. The client should not be responsible for informing the caregivers. Some healthcare agencies, however, do have policies that require a wrist bracelet of some type to be placed on the client with a hemodialysis access device. 443. Regular insulin by continuous intravenous, 4, infusion is prescribed for a client with a blood glucose level of 700 mg/dl. The nurse plans to 1. Mix the solution in 5% dextrose. 2. Change the solution every 6 hours. 3. Infuse the medication via duct and electronic infusion pump. 4. Titrate the infusion according to the client's urine glucose levels. Answer. 3. Rationale. Insulin is administered via an infusion pump to prevent inadvertent overdose and subsequent hypoglycemia. There is no reason to change the solution every 6 hours. Dextrose is added to the 4 infusion once the serum glucose level reaches 250 mg/dl to prevent the occurrence of hypoglycemia. Administering dextrose to a client with a serum glucose level of 700 mg/dl would counteract the beneficial effects of insulin in reducing the glucose level. Glycosuria is not a reliable indicator of the actual serum glucose levels because many factors affect the renal threshold for glucose loss in the urine. 445. A clinic nurse wants to develop a diabetic teaching program. In order to meet the client's needs, the nurse must first, 1. Assess the client's functional abilities. 2. Ensure that insurance will pay for participation in the program. 3. Discuss the focus of the program with the multidisciplinary team. 4. Include everyone who comes into the clinic in the teaching sessions. Answer. 1. Rationale. Nurse-managed clinics focus on individualized disease prevention and health promotion and maintenance. Therefore, the nurse must first assess the clients and their needs to effectively plan the program. Options 2, 3, and 4 do not address the client's needs. 446. A nurse notes that a postoperative client has not been obtaining relief from pain with the prescribed opioid analgesics when a particular licensed coworker is assigned to the client. The appropriate action for the nurse to take is to 1. Reassign the coworker to the care of clients not receiving opioids. 2. Notify the physician that the client needs an increase in opioid dosage. 3. Review the client's medication administration record immediately and discuss the observations with the nursing supervisor. 4. Confront the coworker with the information about the client having pain control problems and ask if the coworker is using the opioids personally. Answer. 3. Rationale. In this situation, the nurse has noted an unusual occurrence, but before deciding what action to take next, the nurse needs more data than just suspicion. This can be obtained by reviewing the client's record. State and federal labor and opioid regulations, as well as institutional policies and procedures, must be followed. It is therefore most appropriate that the nurse discuss the situation with the nursing supervisor before taking further action. The client does not need an increase in opioids. To reassign the coworker to clients not receiving opioids ignores the issue. A confrontation is not the most advisable action because it could result in an argumentative situation. 447. A medication nurse is supervising a newly hired licensed practical nurse, LPN, during the administration of oral pyridostigmine bromide, Mestinon, to a client with myasthenia gravis. Which observation by the medication nurse would indicate safe practice by the LPN? 1. Asking the client to take sips of water. 2. Asking the client to lie down on his right side. 3. Asking the client to look up at the ceiling for 30 seconds. 4. Instructing the client to void before taking the medication. Answer. 1. Rationale. Myasthenia gravis can affect the client's ability to swallow. The primary assessment is to determine the client's ability to handle oral medications or any oral substance. Options 2 and 3 are not appropriate. Option 2 could result in aspiration, and option 3 has no useful purpose. There is no specific reason for the client to void before taking this medication. 448. The nurse does not intervene when a client becomes hypertensive after surgery. The client requires emergency surgery to stop postoperative bleeding later that night. Which type of prosecution does the nurse potentially face for failing to act? 1. Felony. 2. Tort law. 3. Statutory law. 4. Misdemeanor. Answer. 2. Rationale. Tort law deals with wrongful acts intentionally or unintentionally committed against a person or the person's property. The nurse commits a tort offense by failing to act when the client became hypertensive. Options 1 and 4 are offenses under criminal law. Option 3 describes laws enacted by state, federal, or local governments. 449. A well-known individual from the community is admitted to the hospital with a diagnosis of Parkinson's disease. The nurse gives medical information regarding the client's condition to a person who is assumed to be a family member. Later the nurse discovers that this person is not a family member and realizes that this violated which legal concept of the nurse-client relationship? 1. Client's right to privacy. 2. Nurse's lack of experience. 3. Teaching and learning principles. 4. Performing focused physical assessment. Answer. 1. Rationale. Discussing a client's condition without client permission violates a client's rights and places the nurse in legal jeopardy. This action by the nurse is both an invasion of privacy and affects the confidentiality issue with client rights. Options 2, 3, and 4 do not represent violation of the situation presented. 450. Number in order of priority the steps involved in processing an ethical dilemma. Number 1 is the first step and number 6 is the last step. Evaluate the action. Negotiate the outcome. Consider possible courses of action. Verbalize the problem or ethical dilemma. Examine and determine known values on the ethical issue. Gather information relevant to the clinical situation and determine if a true ethical dilemma exists. Answer: 6, 5, 4, 3, 2, 1. Rationale: processing an ethical dilemma requires negotiation of differences, incorporation of conflicting ideas, and an effort to respect differences of opinions. The first step in processing an ethical dilemma is to gather all information relevant to the situation to ensure that a true dilemma exists, because occasionally an overlooked fact may provide quick resolution. Once this has been determined, the nurse should examine and identify his or her own values on the ethical issue. Second step. This is known as values clarification and provides the foundation for clarity during necessary discussions when resolving the dilemma. Step 3 involves verbalizing the problem. Agreeing to the statement of the problem will help those involved to proceed toward resolution in a focused manner. Once the problem is clearly identified, all possible courses of action can be considered. Considering all possible courses of action will reflect opinions that conflict. Step 4. Step 5 involves negotiation of the outcome based on all possible courses of action and points of view. In the best of circumstances, all involved will discover a course of action that is acceptable to everyone. Finally, as the last step, the action is evaluated to ensure the course of action taken is acceptable. 451. A nurse performing an initial admission assessment notes that a client has been taking metoclopramide, Reglan, for a prolonged period. The nurse would immediately call the physician if which signs or symptoms were then noted by the nurse. 1. Anxiety or irritability. 2. Excessive drowsiness. 3. Uncontrolled rhythmic movements of the face or limbs. 4. Dry mouth relieved with the use of sugar-free hard candy. Answer: 3. Rationale: if the client experiences tardive dyskinesia, rhythmic movements of the face or limbs, the nurse should call the physician because these adverse effects may be irreversible. The medication would be discontinued, and no further doses should be given by the nurse. Anxiety, irritability, and dry mouth are mild side effects that do not harm the client. 452. The nurse is outside of a client's room and hears the provider tell the client that the nurse doesn't know anything in a derogatory manner. Which legal tort has the provider violated? 1. Libel. 2. Battery. 3. Assault. 4. Slander. Answer: 4. Rationale: defamation takes place when a falsehood is said, slander, or written, libel, about a person that results in injury to that person's good name and reputation. Battery involves offensive touching or the use of force by a perpetrator without the permission of the victim. An assault occurs when a person puts another person in fear of a harmful or offensive act. 453. The nurse finds the client sitting on the floor, ensures the client's safety, completes an incident report, and notifies the healthcare provider of the incident. Which does the nurse implement next? 1. Staple the incident report in the client's medical record. 2. Document the client events and follow-up nursing actions. 3. Provide a copy of the incident report to the provider and family. 4. Document in the client's medical record that the nurse sent a copy of the report to risk management. Answer: 2. Rationale: the nurse documents the incident completely and objectively in the client's record to communicate client data to the healthcare team. The incident report is a confidential, privileged, and internal document used to improve client safety and quality of care and, therefore should not be copied, stapled, or placed in the chart. Furthermore, the nurse avoids referring to the incident report in the client's record, such as recording that the incident report has been sent to another department. These actions are necessary because any mention of an incident report in the medical record allows the plaintiff's attorney access to the document through discovery. 454. A client had a colon resection. A nasogastric tube was in place when a regular diet was brought to the client's room. The client did not want to eat solid food and asked that the physician be called. The nurse insisted that the solid food was the correct diet. The client ate and subsequently had additional surgery as a result of complications. The determination of negligence in this situation is based on 1. The nurse's persistence. 2. Not calling the physician. 3. A duty existed and it was breached. 4. The dietary department sending the wrong food. Answer. 3. Rationale. For negligence to be proved, there must be a duty, and then a breach of duty. The breach of duty must cause the injury, and damages or injury must be experienced. Options 1, 2, and 4 do not fall under the criteria for negligence. Option 3 is the only option that fits the criteria of negligence. 455. A nurse is caring for a child with intussusception. During care, the child passes a normal brown stool. The appropriate nursing action is to 1. Note the child's physical symptoms. 2. Prepare the child for hydrostatic reduction. 3. Prepare the child and parents for the possibility of surgery. 4. Report the passage of a normal brown stool to the physician. Answer. 4. Rationale. Intussusception is the telescoping of one portion of the bowel into another portion. Passage of a normal brown stool usually indicates that the intussusception has reduced itself. This is immediately reported to the physician, who may choose to alter the diagnostic or therapeutic plan of care. Hydrostatic reduction and surgery may not be necessary. Although the nurse would note the child's physical symptoms, based on the data in the question, option 4 is the appropriate action.